Yes, I have emphasized exercise so many times today. Absolutely. But there's more, okay? You need to think about the neck. You need to think about ocular motor, vestibular, diet, hormonal. You need sleep, anxiety. All of these things need to be addressed. Thank you very much.
So Dr. Bashik, thank you. That was fantastic. I mean, what a deep well that was. I want to dig into some of that. So this whole idea of a concussion being a nociplastic disorder truly is fascinating. So, it really does change how we think about this, as well as the other nociplastic disorders you kind of touched on. We previously discussed, if our listeners went back and listened to our first one, the nociceptive pain, or that pain that's caused by tissue damage or whatnot, the neuropathic pain, that nerve damage pain. But this category of nociplastic pain, or I think you call it the central sensitization model, talk about, again, tell them what somebody should look for if they have to go to, say, the emergency room and they have a concussion.
So in the emergency room, the ER docs, they are always concerned about ABCs first, airway, breathing, circulation, and they always want to rule out the red flags associated with concussion. But once we have a stable situation, it really helps if they begin the process of talking about exercise done in the correct way as a major aspect of concussion recovery. You don't want to be cocooning. You want to get out and be active. I think they certainly could begin anti-CGRP medications if headache is a big complaint. They can certainly start with some of the supplements, omega-3, vitamin D, melatonin, creatine, and then educate this patient. Concussion is a temporary energy deficit that lasts for 3 to 6 weeks. The number one predictor of a short recovery is actually being seen by a healthcare provider that is knowledgeable in concussion care, and then starting treatment as soon as possible.
Okay. I think you bring up a good point. You said it, emergency medicine is really more about stabilization, right? And providing that immediate care for those life-threatening situations. And I completely appreciate that this would probably be the ideal time to really lay that groundwork for ensuring that effective long-term concussion treatment through that education, right? That the patient on what to look for in the coming weeks and months. So to that, when they leave the ED, usually there's a follow-up. They tell you to follow up with your primary care physician in a few days. What would you tell your patient to look for at that visit?
Well, I want to go back to something that you just said, and I do agree with you.